What is bird flu? Avian flu is a human disease caused by the H5N1 virus, which causes mass deaths in poultry such as chickens, geese, ducks, and is actually an animal disease. Influenza A virus has two types of antigens, hemagglutinin, H1H7, and neuraminidase, N1N3. Of these, only viruses with H1, H2, H3, and N1, N2 antigens are known to cause influenza disease and secretions in humans. In 1918, the H1N1 virus killed far more people than those who died in World War I. In 1957, it completely changed its antigenic structure, causing the Asian flu pandemic in the form of the H2N2 virus. It mutated again in 1968, creating the Hong Kong flu pandemic in the form of the H3N2 virus. The causative agent of the Russian flu, which spread to the world in 1977, was the H1N1 virus with the same antigenic structure as the influenza A virus 60 years ago. In influenza epidemics spreading between countries and continents by changing its antigenic structure approximately every 10 years, the agent has always been in the H1, H2, or H3 antigenic structure. Influenza virus carrying H5 or H7 antigen is a different virus, causing illness and death in poultry, and was not transmitted to humans until 8 years ago. However, during the bird flu epidemic in China in 1997, it was determined that the H5N1 virus gained a quality that would cause disease in humans and people die due to avian flu. The disease has spread from China to neighboring countries and has also been seen in Southeast Asian countries such as Vietnam and Thailand. The possibility of spreading through migratory birds to countries on their migration routes has since then been a threat, especially to Asian and European countries. How bird flu infects humans. The risk of transmission of H5N1 virus to humans is low. Transmission to humans may occur as a result of direct contact with sick animals, inhalation of infectious droplets containing viruses, and contact with mouth, nose, or eyes without washing hands after contact with equipment contaminated with viruses. Person-to-person transmission is theoretically possible, but not a viable mode of transmission. What are the symptoms of the disease in humans? The most important symptoms are high fever exceeding 38°C and dry cough. It could be diarrhea. The disease can also be passed out without any symptoms. In cases that are severe enough to require hospitalization, respiratory failure and death rate are high. How is it diagnosed? The diagnosis of the disease in humans is made by detecting the virus or its antigens in throat swab samples. Despite fever, low leukocyte, especially lymphocyte, and platelet counts in the blood may guide the diagnosis. Findings suggestive of viral pneumonia are seen on chest X-ray. How is it treated? There is no fully effective treatment or vaccine for the disease yet. What should be done to prevent the disease? It is recommended that those who have a history of or suspected contact with sick animals or people infected with the H5N1 virus should pay attention to hand hygiene, not sharing items such as plates, forks and spoons used by the sick person, avoiding close face-to-face contact, and the caregiver using a mask. It is recommended to measure his temperature twice a day for a week, and to start drug treatment for 7 to 10 days if symptoms such as cough, diarrhea, and shortness of breath occur with fever exceeding 38°C. There is no effective vaccine that can be used in humans. Vaccine studies for dead and live viruses continue. The vaccine we currently apply as a flu vaccine does not protect against bird flu, however, it should not be forgotten that this vaccine provides effective protection against other influenza viruses that cause disease in humans, and the vaccine should not be avoided. People who will travel to areas where bird flu is present should be vaccinated at least 2 weeks before. It is recommended to stay away from poultry such as chicken and duck. People who cook should also wash their hands after the process. If the traveler has a fever within 10 days after returning from the trip and respiratory symptoms occur, he or she should consult an infectious diseases specialist without delay. Influenza. Influenza A virus has two types of antigens, hemagglutinin, H1H7, and neuraminidase, N1N3. Of these, only viruses with H1, H2, H3, and N1, N2 antigens are known to cause influenza disease and secretions in humans. Thanks for watching the video. Subscribe my channel, support me. Goodbye.